everyone. It is my absolute pleasure to welcome you today to the American College of Lifestyle Medicine's Lifestyle and Performance Medicine in the U.S. Air Force 2025 update. We have got a fantastic presentation today to share with all of you. And we're excited to let you know that, of course, this session is being recorded and questions can be submitted via the Q&A box in your Zoom bottom tag there. And we're going to go ahead and get this show on the road. So I would be more than happy to introduce myself. I'm Dr. Reagan Stigman. I have the great honor of serving ACLM as the Senior Advisor for Military and Veteran Affairs. I myself am a double board certified former Air Force flight surgeon. I hold certifications in preventive medicine and lifestyle medicine. I had the great privilege of launching one of the first lifestyle and performance medicine clinics within the Department of Defense in the Air Force up at the Air Force Academy. I'm very passionate about health promotion and building opportunities for not only warfighters, but any interested human beings who are keen to improve their lives through lifestyle medicine. And I'm honored to also serve as an academic professional. I teach digital health to medical students, and I teach family medicine residents out in Colorado. And I help build digital health solutions for the Department of Defense that are starting to collate lifestyle and performance medicine, all 6 pillars for our warfighters to improve their deployment readiness. And all that to say, I'm more excited about who we get to have discuss their backgrounds and updates in the field today. But first, we're going to walk through a couple of disclosures and disclaimers. And so this is a formal disclaimer from the American College of Lifestyle Medicine. And then the disclosures, of course, on behalf of the presenters. These views reflect not those official views of the U.S. Air Force or the Department of Defense, nor the U.S. government, so that we are doing our due diligence. And of course, the speakers have very intuitively adapted some content from some of our previous leadership in the space of lifestyle performance med and lifestyle medicine, so they are to be acknowledged here. And then, of course, the learning objectives from today's presenters, understanding the importance of lifestyle medicine to the underlying goals of military healthcare, recognizing recent examples of programmatic initiatives to incorporate lifestyle medicine into the military, identifying how practicing healthy lifestyle medicine tactics can relate to traumatic experience, describing and defining physical activity guidelines and fitness requirements that are relevant for the U.S. Air Force, summarizing the impact of physical activity benefits to chronic disease and all-cause mortality, and certainly explaining the importance of the U.S. Air Force Academy's comprehensive lifestyle performance med clinic and examining lifestyle medicine intervention clinical outcomes for patients to foster mental health, resiliency, chronic disease mitigation, and enhance quality of life and longevity. So just to lay the ground for all people on this call, we want to begin with the baseline. And what is lifestyle medicine? Well, we look at lifestyle medicine always through an evidence-based lens because we are scientists, we are physicians, we are healthcare professionals across the board. We follow the science and we follow the research. And we look at lifestyle medicine through these 6 pillars of nutrition, physical activity, restorative sleep, stress management, positive social connection, pardon me, and mitigation of risky substance use, and how those 6 pillars pertain to prevention, treatment, and even oftentimes reversal of some of the most common chronic diseases that we see all too frequently in this country and across the world. So it might come as a surprise when we think about the relevance of why lifestyle medicine, or you'll hear us go back and forth between lifestyle and performance medicine, which is the military's reference for lifestyle medicine, why it matters particularly for the audience of the Department of Defense and for warfighters. Well, turns out there is a significantly ballooning chronic degenerative disease issue that the Department of Defense is facing when it comes to performance, warfighter lethality, and just general deployment and readiness. You'll see some of the most common medical conditions that we see all too frequently diagnosed in our civilian sectors, like prediabetes, diabetes, overweight, obesity, chronic pain, high blood pressure, things of that nature, are also increasing at an alarming rate within the Department of Defense. And that is why lifestyle medicine, or lifestyle and performance medicine, is such a necessary force health multiplier to start moving the needle in the right direction in the name of preserving our warfighter performance and optimization. So with that being said, one of the biggest steps that we have solidified is moving forward just this past November of 2024 with the American College of Lifestyle Medicine and the United States Space Force, where they have announced a truly innovative partnership to enhance Space Force service members or Guardian Health that the Guardian Resilience teams or their embedded teams are practicing. So they're leveraging training all their assets of the GRTs, the GRITs, to become trained, certified, and able to share that common language of lifestyle medicine throughout their various Guardian Resilience teams locations. And we're hopeful to ultimately overlap this sort of launch pad within Space Force to make Relevance to Air Force, to Army, to Navy, and just make it the standard throughout the Department of Defense ultimately. So really excited to have gotten that launch just this past year in November. And with that being said, I have the great privilege of introducing two of my brothers in arms when we served, is where Matt and Nate and I met. And I will first introduce Dr. Major Nate Jones, who is an active duty Air Force physician, board certified in both occupational medicine and lifestyle medicine. He's a fellow of the American College of Occupational and Environmental Medicine, and he volunteers on their board of directors as well. As a diplomate of the American Board of Lifestyle Medicine, Major Jones has served the occupational medicine lead to the U.S. Air Force Lifestyle and Performance Medicine Working Group since 2020. In that role, he has been instrumental in multiple initiatives, including a multi-million-dollar grant for the development of a lifestyle medicine mobile application for the military. Major Jones completed his residency in occupational medicine and his MPH at the Harvard School of Public Health, where his research focused on the implementation of lifestyle medicine principles in workplace settings. He has published, presented, and consulted exclusively and extensively on this topic, and is a co-author of the ACOEM's guidance statement, Incorporating Lifestyle Medicine into Occupational Medicine Practice. I will now happily introduce Captain Matt Dyatt, who graduated with his Bachelor's of Science from the University of Denver in 2006, as well as his Bachelor of Science from the University of Nebraska Medical Center in 2017. He later earned his Master of Science in Physician Assistant Studies from UNMC in 2019 and became certified by the American College of Lifestyle Medicine in 2021. Captain Dyatt is currently providing care to retirees, veterans, and military dependents in the primary care setting at the 10th Medical Group at the United States Air Force Academy. Captain Dyatt is a physician assistant champion of the Air Force Lifestyle and Performance Medicine Working Group, which strives to transform healthcare delivery in the Air Force and military health system, focusing on behaviors as the root cause of disease and partnering with patients to guide their health outcomes. So with that being said, I would like to hand the mic over to Major Nate Jones to lead us into this discussion today. So Major Jones, please take it away.
All right, thanks very much, Dr. Stigman, and greetings to everyone on the call. It's a pleasure to be here and to be invited to speak on this important topic, something that both Captain Dyatt and myself are very passionate about, and we have to give due gratitude to Reagan, who's truly been a force in this space and really one of the founders of lifestyle medicine within the Air Force and the greater Department of Defense and military. So an honor to have her moderate and introduce us for this presentation. Next slide, please. So to set the stage, the military is famous for its acronyms, and you see some listed on the page here, but these are some of the governing documents that would essentially promote the incorporation of lifestyle medicine into military medicine. And if you look at some of those bolded letters and words on the screen, they may remind you of some of the background information that Reagan was sharing about lifestyle medicine in general: promote and sustain health, prevent illness, restore health, optimize performance. Many of these are tenets that are also shared by lifestyle medicine. And at its best, I believe that military medicine is shares many of those same goals with lifestyle medicine. Next slide, please. And here again, you can see side by side that lifestyle medicine and military medicine, if we really get down to the root, I believe, are both focused on improving human performance. And of course, human performance can be and should be intrinsic to even motivation change. If you're working in the behavior change space, everyone needs to have a reason why they're going to make that behavior change. And for the military, it could be so that I can perform my mission. For a civilian, it could be so that I can be more effective in my job, or so that I can be more present for my family and friends. Everyone needs a reason why. And I think that the military's focus on performance and incorporating lifestyle and performance medicine is a perfect application of that important aspect of behavior change. Next slide, please. So as Reagan had alluded to in some of her introductory remarks, this is a problem facing the US military in terms of the health of our warfighters and their ability to effectively accomplish that mission. This is a challenge that affects the military at all stages of what we call the human weapon system. So that includes both pre-accession of our military members before they even join the military in terms of recruiting. Do we have a population that's healthy enough to meet the standards and requirements to serve in the military and to complete the missions that we'll expect them to complete as a military member? And then while someone is serving in the military, you can see some of the metrics there on the screen. A growing problem, no pun intended, of overweight and obesity within the military, and how that translates and affects someone's ability to then potentially deploy or otherwise complete the requirements of their specific position within the military. And also a growing number of military members with one or more chronic medical conditions, many of which are very applicable to lifestyle medicine and very amenable to lifestyle medicine interventions if we can identify them and apply the proper therapeutic intervention. And then moving out of the military as individuals become veterans after their military service, there's a very well-documented trend that unfortunately many veterans struggle with numerous medical conditions, perhaps even at an elevated rate compared to age and otherwise matched controls who did not have military service. Some interesting data that's come out in terms of we essentially select some of the healthiest individuals to serve in the military, and then they come out as some of the less healthy individuals in our society. What's happening in between, and what can we as the military, or what should we be doing as the military to change that trajectory? Next slide, please. The military has made some strides to try to incorporate or to try to formalize an approach to deal with some of these concerns that are being recognized. Total force fitness is the name that's given at the higher levels of military leadership to a framework that can be applied to addressing some of these issues. You can see the 8 different domains of total force fitness as they're identified in some of the military publications. And again, you should recognize that many of these look familiar to us in lifestyle medicine. Some of them, do not fit perfectly, but I think if you really dive deep, you can see that there are many similarities, and that the military is trying to get after some of these more holistic, more behavior-based functions that we all know are just bedrock important to individuals' health. And, as it says on the screen, also to an individual's ability to meet their functional requirements of day to day. That could be a military member, that could be a civilian who still needs to go to work, take care of their family, whatever those functional requirements are. As healers, as healthcare providers, that ultimately is one of our main goals, is to facilitate people's ability to engage in their daily activities in a way that's meaningful and fulfilling to them. Next slide, please. A unique aspect, I would say, of military medicine and its engagement with lifestyle medicine specifically, is the approach of integrated operational support. Now, the idea behind this framework is to take some of these principles and apply them to military members outside of the clinic. As healthcare professionals, many of us, that's our largest area of influence with our patients, those that we're seeing. But integrated operational support carries with it the tenet that people spend much more time outside of the clinic than they do inside of the clinic. And so if we're going to have maximal impact on someone's behavior or to best assist them in their own behavior change journey, we need to meet them where they are and to engage with them and intervene where they are. And so, especially as an occupational medicine physician, this speaks very clearly and passionately to me and my interests, which is people spend a lot of time at work. Military members essentially could work, live, sleep, play, all of it on the military installation. And so, what kind of environment are we creating? And we'll talk about this a little bit later in my portion of the presentation, that promotes a culture of health across the board. And again, carries also that strong focus on mission performance. How are we enabling people to meet the functional requirements that they have in their day-to-day life? Next slide, please. So now we'll discuss briefly the U.S. Air Force approach, as well as some of the other branches and some of their efforts to incorporate lifestyle medicine to operationalize that total force fitness framework that I had mentioned in a way that is beneficial to not only the health of our service members, but also their performance. Next slide, please. And Reagan had mentioned this as well, so I won't belabor the point, but essentially when we talk about lifestyle medicine in the military, many times we use the interchangeable term of lifestyle and performance medicine, and that is to emphasize the important aspect of a military member's performance and the focus that any lifestyle medicine interventions within the military can and should have on a service member's functional ability. You can see some of the goals, of lifestyle and performance medicine in the military. And again, I would argue that actually incorporating that focus on performance and functionality could be a very beneficial piece, even for lifestyle medicine practitioners on the civilian side as well. Next slide, please. The U.S. Air Force Lifestyle and Performance Medicine Working Group, from which Captain Diat and I both come to you for this presentation, is an officially chartered working group. Again, Dr. Stigman was one of the founding members of not only this movement, but the working group. The working group has been around for a while and has definitely some very high level support, both originally and on a continuing basis. And as Dr. Stigman had also mentioned, really focused on that evidence-based implementation of lifestyle and performance medicine within the U.S. Air Force and expanding that to our sister branches as well. Next slide, please. The rest of my portion of the presentation will be spent on sharing some brief examples. Many of these examples could have their own individual presentation, but I'll try to be mindful of my time and give Captain Diat his due time. But many of these examples fall into these different lifestyle and performance medicine working group lines of efforts. You can see the 7 listed on the screen, which are the different areas or domains within which we have tried as a working group to promote lifestyle and performance medicine in the Air Force and beyond. And again, I'll share some examples in some of these different areas. It's not inclusive by any means. There are things that I just had to leave out, but hopefully it's of interest to you. And I think that it's, honestly pretty rewarding to see how much work has been done, of course, recognizing how much further we have to go. Next slide, please. Starting with policies and procedures, on the next slide, we'll see a developing situation, which is the Air Force Body Composition Program. This is a pendulum that has swung back and forth multiple times, and it does the same in our sister branches as well. But the latest swing is that military members, Air Force members specifically, will be required to have annual body composition assessment by the waist to height ratio measurement. And those identified as being at higher risk based on that measurement and a risk matrix will then be vectored towards both primary care evaluation to identify and potentially correct any kind of underlying medical condition that might be contributing to that risk assessment. Or, hopefully, especially, we can also engage individuals with evidence-based lifestyle medicine principles that will help to correct maybe an early concern or what could develop into a concern down the road. The overall idea is to be more proactive in identifying individuals who are at higher risk and connect them with the appropriate resources so that they can course correct and start a new trajectory towards health and, again, performance in the military. Next slide, please. Dr. Stigman had mentioned the U.S. Space Force, which is the newest branch of the military. I will say has also probably been the best so far and the most forward-leaning in terms of incorporating lifestyle medicine. Very exciting that they have committed to train formally their Guardian Resilience teams in lifestyle medicine principles and make sure that everyone is speaking that same language as they're going out and now trying to promote the health of their guardians in the U.S. Space Force. An interesting approach that they are taking is more of a longitudinal assessment of health and fitness, as opposed to the more intermittent assessment of health and fitness, which is the kind of MO for the other branches of service. I believe Captain Diot will mention that a bit in his presentation. But incorporating into that longitudinal assessment over time, consistent assessment, also opportunities to intervene then. It's not a once a year check-in, oh, we're off course, now we need to do all of this hard work to kind of drag us back onto the path. Gives some opportunities for maybe more minor course adjustments as small deviations are noticed on a more regular basis in terms of intervention. Next slide, please. And going into the education and learning portion, next slide. There are two main directions that education and learning can take. One, that education and learning could be targeted at the individual service member, or it could be targeted at the healthcare providers in the military who are now providing additional information and opportunities for our service members to learn about some of these important lifestyle medicine principles. The Nutrition Kitchen Culinary Education is a series of videos and other informational topics on nutrition that allow our service members to digest, no pun intended, information about how they can maintain a healthy diet. And specifically, this can be challenging for some of our service members who are especially young, don't have maybe much experience, if any, living on their own, and now essentially maybe for the first time in their lives have free reign over what food they have available to them and how much of it they're going to eat and what food specifically they're going to choose to eat. So some of these videos, again, are targeted at meeting our service members where they are and in a way that could be engaging to them, as well as providing additional resources where they can actually grab some recipes, look up simple things that they would be able to do to really promote their own health and set themselves up for success in terms of their health and performance in the military. Next slide, please. And here, of course, is an example of the other aspect of education and learning, which is targeting our military healthcare providers to make sure that they are aware of the important relationship that lifestyle medicine principles can have on their own work promoting the health and performance of our military members. Lifestyle medicine has been formally incorporated into multiple graduate medical education programs through residency programs and directors at various sites around the military. And there's also been a very active lecture series within the military for healthcare providers to tune into different webinars, virtual presentations such as this, and then receive continuing education credits. And the Lifestyle Medicine and Lifestyle and Performance Medicine Working Group has been very active in vetting and providing some of those educational opportunities to our military healthcare providers. Next line. And next slide, clinical research and publications. I removed some of the original slides I had included in here. There are too many examples of this that's happening in the military, which is good. It can be overwhelming, but there's just a lot to bite off here. But one to highlight for us today is the Consortium for Health and Military Performance, also known as CHAMP, based at the Uniformed Services University of Health Science. And this institution actually really checks many of the boxes on those lines of effort that we're trying to work our way through. They perform research, they do consultation, they do education and outreach, and they also organize many engagement opportunities, including different summits and meeting opportunities for military healthcare providers and other health promotion specialists. Two, to draw your attention to personal protective lifestyle and personal protective nutrition. Again, I know Dr. Stigman was intimately involved in some of those efforts to stand up some of these educational offerings, which were very timely in their release associated with, some of the COVID COVID-19 pandemic, and how we were all becoming familiar with some of that terminology and really leveraging some of that momentum to now look at, well, how can we incorporate lifestyle medicine into the COVID response, and not just for COVID, obviously, but for our overall health and performance as well. An interesting aspect of what CHAMP does is they will really focus again on the individual requirements for a military member to do their job in some of their consultation work, where they'll actually go into a workplace, into a military unit, and first try to understand exactly what are these military members expected to do. And then they'll bring in the multidisciplinary team, nutrition, physical activity, actual spiritual as well, mental health, and be able to come up with an intervention plan for that unit to promote the functionality of the warfighter to actually complete the requirements for their specific tasks within the military. Very impressive. They're very scientific and rigorous, and it's been a pleasure for me to work with them on a few different projects. Next slide, please. Key leader engagement, next slide. Mostly I wanted to highlight many of the different summits and meetings. I'd mentioned CHAMP at the Uniformed Services University of Health Sciences is involved in the Total Force Fitness Summit. There are many others. You can see the Air Force Lifestyle and Performance Medicine Summit, which is probably the most applicable to our group, but multiple other opportunities that have been set up and developed to bring together leaders and thought leaders in this space. And it's exciting, honestly, to see much of the uptake that is coming out of these meetings with key and very influential leaders throughout the military. Next slide, please. Next slide, clinical coaching and integration. Obviously, one of the forefronts of this effort needs to be in the clinic, where we have trained, educated, informed, and experienced healthcare providers who are able to have these one-on-one conversations with their patients as they're seeing them. You can see that there's a growing movement to have formally recognized Department of Defense clinical sites with lifestyle medicine expertise, as well as specifically identifying those lifestyle medicine certified providers within the military, so that we can effectively resource different clinics who may have greater or lesser need for lifestyle medicine within their specific duties that they need to fulfill. Next slide, please. Here's an example of one of those integrated operational support teams, essentially, I would call it, of an airman resilience team, which parallels the Guardian resilience team that we had seen earlier. You can see maybe a bit of a different framework here that they utilize and makeup of their team. But the idea here is that the team is embedded within the unit and meets, again, the individuals where they are outside of the clinic, and now being able to work with the unit, the individual warfighters in the unit, and also the leadership to come up with a plan to promote and optimize the performance of their team. Next slide, please. Operational support team is another example. I specifically love working with our operational support team on my base. They're very data-driven. They look at as many objective measurements as they can to identify which unit they should spend time with next. And then they'll bring their multidisciplinary team and spend 2 to 3 months with a particular unit, instructing their physical training leaders in that unit, working on diet plans for the unit, teaching them about sleep, about mental health, and then being fully integrated with the unit. Again, they have that inside look at what these individuals actually need to do and how can we support them with some of these lifestyle medicine principles. Next slide, please. And the next slide. Nearing the end of my portion of the presentation, I just wanted to highlight some of the different culture of health, kind of higher level initiatives that can inform decisions to integrate lifestyle medicine into the military. One example is a hero report, as it's called, and gives the ability for leaders to both benchmark their individual units, installations of, how are our service members engaging with different principles of lifestyle medicine? Where are the opportunities for intervention? Next slide, please. And lastly, the Military Nutrition Environment Working Group is one that I've recently become involved with and is doing some really exciting work in terms of evaluating the nutrition environment of our different military installations and what are the opportunities for intervention there. One win over the past several years has been to pilot and now proceed towards further adoption of plant-based MREs, which the military is famous for. But there are many other examples. Again, this could be a complete presentation just by itself. Next slide, please. And I just wanted to highlight also the American College of Occupational Environmental Medicine, which again is my primary specialty outside of lifestyle medicine, highlighting the efforts that the occupational medicine community is now engaging with to bring lifestyle medicine into the generic workplace. We're talking about the military workplace today, but at large, how can the workplace become a platform to promote health? Next slide, please. You can see the military, in terms of the programmatic initiatives to implement lifestyle medicine has strengths. We also have opportunities for improvement. I would say that one of the challenges within the military is how large the organization is. We can create a lot of redundancy and fail to break down those silos, which could otherwise create a lot of synergy. Definitely an opportunity for us to continue to push for that highest level support within the military so that that perspective can be used to identify duplicative efforts and then combine those to the benefit of our warfighter and their ability to accomplish the mission. Next slide, please. That concludes my portion of the presentation today. And with that, I'll pass things over to Captain Matt Dyott.
All right. Thank you, Major Jones. Thank you, Dr. Steegman, for the introduction. Hello, everyone. Thank you for joining today. Slide, please. I'm going to first start by kind of talking about some of my history and how it relates to lifestyle medicine, and then I'll transition into lifestyle medicine within the Air Force. So a healthy and active lifestyle, it's always been a significant part of my life. I grew up playing a multitude of sports, which gave me a strong foundation for functional nourishment and movement. Grew up playing soccer for about 13 years, had a passion for track and field, was not great at baseball, but my goal ultimately was to find a sport that I could play in college and perhaps even earn an athletic scholarship. Eventually, in early high school, I took up triathlons. However, I knew it wouldn't get me a college scholarship, but through the years in high school, I had to kind of narrow my focus to one sport and dedicate everything I had to it. And that's when I was talked into swimming full time from coaches, family, and friends. And in these pictures here, you can see I'm trying to get some cycling hours in while doing homework. I also had boxes full of trophies and ribbons, not just from track and field, but also from soccer, baseball, cross-country running. And during my childhood, I was fortunate enough to have parents that made camping and boating a priority. And I took part in all watercraft sports behind a boat. Slide, please. So swimming was a top priority. I joined a club team out of Federal Way, Washington called King Aquatics. Joined the summer of my junior year in high school. And 6 months later, I became one of the top sprinters in the state of Washington, and then later qualified for Olympic trials and received a full swimming scholarship to the University of Denver. To become part of the 1% of all college swimmers to make it to Olympic trials, that definitely emphasized a focused optimization of health metrics, supplementation, dedication through the ups and the downs, consistent training ethic, and a positive mindset. Slide, please. 9 months of grueling training led me to the Washington State Swimming Championships in February 2004. And my strong foundation gave me confidence going into every event, which I took the title of all 4 events that I was allowed to swim, set state and high school records, and led my team to its first ever victory for Thomas Jefferson High School. The following month, I was shaved and tapered for the American Short Course Championships in Austin, Texas, and swam even faster than I did at the state championships. Slide, please. Here's some pictures from my time in the military and my exercise hobbies. Road and mountain cycling were just in my blood. This is a picture of when I rode to the top of Piancavallo when I was stationed in Aviano, Italy during my enlistment time. I even joined a cycling team there and rode all over the Dolomites in Italy. I continued to do triathlons there. I made CrossFit a priority. And then later, as I transitioned to being an officer, took up kiteboarding and kite surfing, seen here at Hood River, Oregon. And all of this, kind of what I like to call hormesis, which is, these hormetic stressors. Physical activity is a wonderful, hormetic stressor on the body. It's small bits of acute stress, which, ultimately are playing directly into our health. And I almost felt like, I was training for kind of the worst day of my life. And sure enough, unfortunately, that worst day of my life did occur. Slide, please. So on January 16th, 2022, my girlfriend Kim and I, now my wife, were ambushed by three assailants during a robbery and attempted carjacking in San Antonio, Texas. Despite surrendering, one member fired his weapon at my head, and I'm told I collapsed to the ground, barely alive. I was transferred to Brooke Army Medical Center in critical care, having suffered an extenuating hemorrhage, blindness, deafness, and disorientation, and then rushed into a 12-hour neuro-ophthalmic surgery. And after waking from a 3-day surgically induced coma, I began the long road to recovery with new disabilities and constant severe pain. But despite the inability to control the food options in the neurotrauma ICU, the one thing that was within my control was physical activity. I was weakened, nearly 8 pounds lighter from overwhelming systemic trauma, yet despite the pain and the unsteadiness, I knew that moving my body would accelerate healing. Slide, please. At first, the ICU staff was hesitant since most patients take several weeks to become well enough to begin to move again. However, I was persistent. I started with small walks around the room with Kim's help. Once the staff witnessed my determination, they allowed me to walk around the ICU halls with my IV fluid bag on a rolling stand. This first trip down the hall was a major victory and indication that although I had a long way to go, the path to healing required small steps of courage. The daily walks kept me focused and kept the negative and defeating thoughts at bay. And after only about just over 2 weeks in the ICU, I was strong enough to function on my own and was allowed to be discharged. However, the following 3 months would prove to be an even greater challenge. Throughout the healing journey and reorientation into my new baseline, constant fatigue, somnolence, and pain would persist, yet the medicinal and healing power of movement and continued focus on the lifestyle medicine essentials allowed my body and brain to adapt and result in a remarkable recovery. Over the following months, I had weekly visits with a multitude of specialists to assess and minimize the high probability of cognitive and physical disabilities. And the road towards rehabilitation included physical therapy, occupational therapy, neuropsychology, speech therapy, visual spatial therapy, cognitive behavioral therapy, and driving lessons. Although each day I saw increments of improvement, I was still in disbelief about what happened and struggled with adapting to my new disabilities. The traumatic brain injury left me with many secondary conditions such as left eye blindness, syndrome of inappropriate antidiuretic hormone, autonomic dysfunction, insomnia, anxiety, tinnitus, and hearing loss. Yet I refused to let tragedy define me and prevent me from returning to my highly active and outdoor focused lifestyle. My incredible strength and resilience was forged by my sole focus on lifestyle basics, including sleep, nourishment, mindset and gratitude, and daily movement. As each week passed, my neurosurgeons, plastic surgeons, otolaryngologists, oromaxillary facial surgeons, and neurologists were both impressed, but also baffled by how well I was recovering from such a severe traumatic brain injury. Slide, please. So this photo, the one on the left, was taken about 1 month after I was discharged from the hospital. This was kind of me just kind of feeding the fuel of fitness with a very mild hike in the local park. And then the picture on the right was taken about 6 months ago of my wife and I mountain biking in Moab, Utah. Slide, please. And so just for the sake of time, here again are the 6 pillars of lifestyle medicine, which I completely focused on during my recovery, which unfortunately will probably be never ending. That type of injury will be a lifelong recovery. However, utilizing these things has actually helped me get back to such a stable level that like I said, individuals and specialists have been kind of confused on how well I was able to, come back and function and practice medicine and things like that. Slide, please. So physical activity, one of the best things people can do to improve their health. Physical activity, it's vital for healthy aging, and it can reduce chances of obtaining some chronic diseases and preventing early deaths. Aerobic and endurance activities include running, swimming, biking, hiking, playing sports, dancing, and brisk walking, whereas strength or resistance activities include weightlifting, pushing a wheelchair or stroller, kettlebells, and bodyweight exercises such as squats, push-ups, lunges, sit-ups, etc. Flexibility activities include stretching and some forms of yoga. And then balance activities include Tai Chi, Qigong, and some forms of yoga. And according to a 2023 meta-analysis of large prospective studies, found that physical activity reduced all-cause mortality by 31% compared to no physical activity. So very significant. Slide, please. This is the Department of the Air Force physical fitness program. And kind of like Major Jones was saying, a lot has changed over the past few years regarding the Air Force fitness program. But the goal is to motivate all members to participate in year-round physical conditioning that emphasizes total fitness, to include proper cardiorespiratory conditioning, muscular endurance training, core endurance, and healthy eating. And they specifically state that the active lifestyle increases productivity, optimizes health, and decreases absenteeism while maintaining a higher level of warfighter readiness. And these are just some of the required physical fitness items that we partake in. And then here, this again is just kind of saying that if we score at a certain level, then we're due for a retest in about 12 months, and we have to have a minimum of a 75 or higher to pass. Slide, please. So now I'll transition to my comprehensive lifestyle and performance medicine clinic here at the Air Force Academy. I'm the director of lifestyle and exercise medicine here, and I run a clinic that essentially provides an opportunity for over 12,000 Department of Defense retirees, veterans, and dependents to learn how to better manage their health conditions over a long health term. And it consists of monthly appointments facilitated by a lifestyle and performance medicine specialist, which at this point would be myself, other behavioralists, registered dietitian, and a health promotion coordinator. The lifestyle medicine specialist works collaboratively to help patients realize their fullest potential through strategic lifestyle change. Appointment structure includes focus on nutrition, physical activity, sleep, stress management, and behavior change. And studies suggest that military veterans experience mental health disorders, substance use disorders, PTSD, and TBI at disproportionate rates compared to their civilian counterparts. And unhealthy behaviors are paralleled by disease outcomes and correlate with misinformation, sedentary lifestyle, lack of self-discipline, and convenience of living. And the program is intended to assist with increasing physical and cognitive function, quality of life, and decreased risk of all-cause mortality. Military spouses and family members provide critical reinforcement in solidifying whole warfighter health. And the underlying health status of military spouses and military family units alike are vital to maintaining the health and performance of the warfighter, especially those in deployed settings. By augmenting the structured care for the warfighter, airman readiness will remain high. The program is designed to offer about 6 to 8 lifestyle and performance medicine appointments that are synonymous with the lifestyle medicine 6 pillars. First appointments about 60 to 80 minutes, and appointments thereafter about 30 to 60 minutes. The majority of patients, I implement some form of functional medicine workup and treatment as well. And that can take additional time, include more complex lab work, imaging, and dietary supplement guidance and recommendations. Some chronic diseases that I specialize in are ASCVD reduction, prediabetes and type 2 diabetes, hypertension, hyperlipidemia, hypertriglyceridemia, obesity, tobacco use, insomnia, autoimmune conditions, and cancer. Health coaching, motivational interviewing, and habitual adaptation are key to patient adherence and compliance. And I would say a majority of patients start their lifestyle medicine journeys with the 7-day plant-based challenge, and 100% of participants showed improvement in at least one biophysiologic category or lab result after intervention. We also have a 6-week lifestyle medicine challenge that is being offered and recommended to all lifestyle medicine patients. And soon I'll be directing and treating groups of lifestyle medicine patients in shared medical appointments. Slide, please. And so here are some kind of pre-post, I didn't list them all, but I'll just kind of run through them really quick. Pre-post program metrics that we typically run through. Arthropometrics is what we call them. Weight, body fat percentage, waist to hip ratio, blood pressure, hemoglobin A1C, fasting blood glucose, traditional lipid panel, lipoprotein fractionation panel, lipoprotein little a, apolipoprotein B, oxidized LDL, homocysteine, uric acid, ultrasensitive CRP, and VO2 max. And the results are significant and noticeable improvements in these biophysiologic parameters, and it was appreciated by all participants in one capacity or another. And remission of chronic disease, specifically type 2 diabetes, hypertension, hyperlipidemia, overweight, obesity, and chronic pain were achieved and sustained. And then, of course, de-escalation of therapeutic medications such as antihypertensives, lipid-lowering medication, and diabetes management medications. And lastly, some program limitations include small study size makes for less statistical power and confidence in results, but at lower costs. Some patients experience difficulty with lifestyle medicine sustainability between clinic visits and with self-management outside of the clinical setting, for example, being overwhelmed with the dietary pillar, and limitations were linked closely to patient behavior change, which has at times prevented follow-up appointments and created gaps in overall care. This concludes my portion, and now I'll hand it over to Dr. Stiegman.
Captain Dye, I so appreciate your willingness to share what is not only an incredible story and reality of your life, but your persistence through it. And you are the true living, breathing proof of not only showing up as a warfighter, but showing up as a healthcare professional to live and breathe, and then show your patients and your fellow warfighter family how to apply lifestyle medicine. So I'm so grateful for you for sharing your story and how personal it is today, and still continues to be. And Major Jones, I wanted to thank you as well before we launch into Q&A here in a couple of minutes, for your really remarkable integration through an occupational medicine lens of how we can really make a case for integrating more intentionally lifestyle med and lifestyle performance med for our warfighters, for exactly warfighter wellness. We don't talk enough about that, and I think you've set a wonderful pace. So what I'd love to share with the attendees here is one of the very first American College of Lifestyle Medicine story projects that was actually filmed at David Grant Medical Center at just outside of Travis Air Force Base, where we captured the stories of Major Jeff Smith and Dr. Bree Garis, as well as a handful of other Air Force professionals. You can use the QR code to access this storyline and really just see the relevance that is woven in, especially through the lens of improving mental health through lifestyle medicine practices. Quite a remarkable link with respect to mitigation of anxiety, depression, things of that nature, and how closely those are tied to things like movement, nutrition, making sure you're eating the right things, managing your sleep the right way. So make sure you capture this QR code and give that story project a watch for a little bit deeper dive of the relevance of lifestyle medicine as it pertains to national security. And then I wanted to remind everyone that with this QR code here, you have the opportunity to access the Lifestyle Medicine and Food as Medicine Essentials course, which is essentially a 5.5 free CME, continuing medical education or continuing education opportunity that ACLM committed to on behalf of the White House conference several years ago, that we're offering the opportunity to build the foundation truly for healthcare professionals who want to set the tone for how they can deliver lifestyle medicine to their patients, perhaps practice it for themselves. And these modules look at the introduction of lifestyle medicine, using food as medicine for nutrition, for prevention and longevity, and then food as medicine, using nutrition to treat and reduce risk across the board. And you can use the promo code here, which is WHC22, to access this opportunity for free. So please make sure you make good use of that. And then, of course, we always want more participants to join our ranks. The lovely thing about the American College of Lifestyle Medicine is that it is a wide aperture, open opportunity for physicians, PAs, nurses, pharmacists, registered dietitians, everyone and anyone in the healthcare space to come together, collate, build those strong teams to deliver lifestyle medicine the right way. And that is through an effective team and multiple touch points. So please don't hesitate to join us. This specifically is the VA and the DoD member interest group. You can capture this QR code and join us. You do have to be a member to join. So don't hesitate and hop on and find where you might land in the most effective member interest group. There are tons of them out there. So I guarantee you'll find a spot for your passion if you go start looking around. And then finally, just want to put a final plug, as mentioned, for certification in lifestyle medicine. There are over now 8,000 physicians and clinicians around the globe who have become diplomates of either the American Board of Lifestyle Medicine, the International Board of Lifestyle Medicine, or the American College of Lifestyle Medicine. This is one of the fastest growing medical subspecialties, and for good reason, folks. We are getting back to how we truly heal human beings and how we get them to a place where they optimize at their peak potential. So you can scan this QR code and access the pathway to certification as you see fit. And then, of course, we had to plug the annual conference for Lifestyle Medicine 2025 coming up in November 16 through 19 in Grapevine, Texas. So make sure you join us. It's going to be a fantastic event, much like all the years prior. QR code can link you to this as well, but these conferences sell out quickly. So make sure you secure your spot and join us in person. There are virtual options as well. So now what we will pivot to with the remaining time left of this webinar are Q&As. And if you would be so kind as to pop some questions into the Q&A section of the Zoom chat, we will walk through and discuss a handful of those questions as well. And I know that Doc Jones had already discussed one of the questions that came through about waist to height ratio, which might seem a little bit more helpful than BMI, and specifically what his thoughts were on why it's not more commonly used in the primary care setting. And I know, Nate, you offered an answer, but if you want to just do a quick synopsis, that would be great.
Sure. And I'll say, as someone who doesn't, I'm not a primary care physician. I can't necessarily speak to, why the waist to height ratio might not be utilized as much during primary care visits, and in that setting, I think from my lens as an occupational medicine physician, again, one of my just bottom line questions with every patient I see is, can this person do what they need to do? What is their functional capacity to be able to perform? And so if waist to height ratio gives us a better kind of proactive early look at someone's ability to do that, without putting them on a treadmill or, having them lift weights or whatever kind of specific functions we're requiring them to do as a worker, as a military member, then I'm all in favor for it. But unfortunately, not too much else to share in terms of specifically why that may not have been adopted on the primary care side of things.
Wonderful. Thanks, Doc Jones. I appreciate that. And I think as we all sort of start stepping to the table with different measures that perhaps might make more sense. For example, I know Captain Diat and Major Jones, we talk a lot about leveraging body fat percentage as a more accurate snapshot of, as opposed to just BMI. But once again, we have to sort of play with what we have, certainly with respect to electronic health records and data that we have historically as well. So here is a question from one of our participants. Total Force Fitness has 8 components, but the military and Air Force only measure 1, typically physical fitness. Unit leadership is expected to, quote, figure out if someone needs help in another area. Should we do more to assess the others or take a similar approach to physical fitness? Major Jones, would you like to start, and then Captain Diat follow on?
Yeah, I mean, the short answer is yes. I think we should do more. I would say the Army actually has kind of a newer initiative. It's called Holistic Health and Fitness, or H2F, that is trying to do more and maybe is a little bit further ahead in terms of measuring some of the other domains, both of lifestyle medicine and of total force fitness. And they've actually developed different screening tools and metrics that they can use in that sense to, assess. And then, of course, the assessment piece is only useful if then we can intervene and make some kind of change or improvement on that assessment. So, yeah, short answer is yes. There are some early tools out there. The CHAMP resource at the Uniformed Services University that I had mentioned in my presentation, they also have a number of different screeners and metrics that can be used in some of the different domains of total force fitness. But in terms of the widespread adoption, you're absolutely correct that there's not much being done formally besides the fitness assessment. There are some questions asked subjectively to our members during annual health assessments. But I agree with you that we should be doing more.
Captain Diat, anything to add to that?
Not really, just kind of echoing what Major Jones said. Yeah, 100% agree that, we're trying to take the best steps forward with, getting this implemented. And of course, since it's kind of somewhat, new to the military in a way, it's kind of taken some time and some, very desired efforts. So.
And I think a big thing to hit on here is that we know that the military across the board, joint services, has been quite myopic with respect to focusing on physical activity as the solution. And we know that we have all the remaining pillars of lifestyle medicine, arguably of which nutrition is one of the most robust. So I think we are helping to start pivoting that narrative toward why we are still seeing this continuous burden of disease continue to stack up over time, right? Because you can't exercise your way out of a bad diet. And I think that's the old adage, but we're collectively working that effort. So here's another question for the team. Are there any opportunities to integrate AI in customizing meal and personal workout plans for active duty members? Major Jones, you maybe want to take a swing at this?
Sure. And yeah, Dr. Stigman, I'll throw you under the bus a little bit too, but Dr. Stigman and I were both heavily involved in the development of a mobile application platform to essentially, capture some of the other domains of total force fitness and lifestyle medicine in terms of how often or how well individual service members were engaging with some of those domains. What are you eating? How much? Hydration, sleep, all of these aspects, including the integration of different wearable technology into that. And part of that mobile application was not only the collection of data, but was also incorporating AI to then generate prompts, nudges back to the member, educational offerings of, hey, you're off track for, whatever, be it calories for the day or water, sleep. Here's a brief educational intervention or a quick nudge, a virtual nudge to maybe get you back on track. And AI was definitely part of that. And, again, my answer will be the same, that yes, more could be done. And that's not something that's being widely, rolled out at this point across the military. I would argue that it could, or maybe even should be. But yes, AI, of course, is a tool that finds application in almost every setting, both, medical and otherwise. And I think it would be smart to leverage that tool to the extent possible to the improvement of our warfighter health and performance.
Fantastic. Captain Daya, last question here before we're going to have to wrap prior to the top of the hour. How successful are you working within the military system in providing more whole food, plant forward choices for military personnel? And how have you been able to help carry that discussion or those opportunities with MREs or other things of that nature?
Yeah, really good question. Hot topic. Unfortunately, my kind of place here at the Air Force Academy, I'm not working anymore directly with active duty service members. I'm more on the retiree veteran dependent side, but that is definitely something that I think we also need to look at addressing. I know that in our EHR there are some patient handout resources that are specific to dietary recommendations. However, I think that still needs some combing through. And then, yeah, when it comes to MREs, I mean, if anyone's ever seen the nutrition label on MREs, you almost have a little bit of chest pain just looking at it, because some of the MREs include trans fat. But yeah, those are really important topics and things that we're continuing to develop with at higher level leadership, and continuing to make strides. But yeah, kind of small steps at a time for now.
Wonderful. Well, we are at the top of the hour, and I just really want to thank everybody who joined us today. We had a pretty remarkable showing of participants, so it is our absolute honor to host you and hopefully to host more of these military-centric lifestyle medicine presentations to make sure that all of our collaborators across the board are up to speed, and so that we can be stepping up to the plate to provide our powers and our talents across an interoperable platform, because that's exactly how we're going to start seeing the most profound gains for our warfighters and for our country alike. So Captain Dayat, Major Jones, I really want to thank you all today for providing your insight and expertise. And please feel free to connect with us here if you have any questions about the webinar for today. And just wanted to remind everyone that the session was recorded and a follow-up email with the recording will be sent out very soon. Thank you all so much.